Aloha, everyone. Welcome to the Hawaii State Senate Health Committee. I'm Senator Jarrett Kehokalole, chair of the committee. This Zoom meeting and YouTube live stream event will include the Wednesday, March 3rd, 1 p.m. agenda. Considering for confirmation, Dr. Libby Char as Director of the Department of Health. The members of this committee include my Vice Chair, Senator Rosalind Baker, Senator Sharon Moriwaki, Senator Joyce-Ann Buenaventura, and Senator Kurt Favela. In the unlikely event that we must abruptly end this hearing due to major technical difficulties, the committee will reconvene to discuss any outstanding business on Friday, March 5th at 1 p.m. and a public notice will be posted on the legislature's website. What I'd like to do is go through the list of testifiers, beginning with the governor's chief of staff and our state agencies who have indicated that they are present to give oral testimony. Then I will go through the written submitted testimony. There are over 100 pieces of individual testimony from organizations and individual members of the community, all in support. And then I'd like to ask the director to submit her, include her remarks. So on that note, I'd like to start with the governor's chief of staff. Linda, please.
Thank you, Chair. My name is Linda Chu Takayama. I am speaking on behalf of Governor David Ige, who stands in very strong support of the nomination of Dr. Elizabeth Char to serve as Director of the Department of Health. He urges your quick confirmation of this nominee, and so we stand ready to answer any questions you may have. Thank you.
Thank you very much. Next, we have the Department of Agriculture and support.
Aloha Chair, Vice Chair, and members of the committee, Phyllis Shimabukuro Geyser, Hawaii Department of Agriculture, stand in very strong support of Dr. Elizabeth Char. Just wanted to give you a little bit of information. She's the salt of the earth. I remember first meeting her as a volunteer at this Hawaii State Farm Fair. And, you know, she was packing and unloading and stocking produce in the farmer's market. So, you know, Libby, back then we knew her as Libby Char, and I don't know if she was still a medical school student at the John A. Burns Medical School or she was an intern, but, you know, she found the time to be a volunteer. And so she's very humble, and I think that she would be excellent as the Director of the Department of Health. Mahalo.
Thank you very much, Phyllis. Next, we have the Department of Commerce and Consumer Affairs, Director Colon.
Hi, good afternoon, Chair, Vice Chair, members of the committee. Kat Awakuni Colon on behalf of DCCA. You have my written testimony. I wholeheartedly believe that Dr. Char is doing everything she can to assist us in this emergency situation that we find ourselves in. Have nothing but respect for the way that she has been conducting herself and leading the Department of Health. And so I stand by and can answer any questions you may have. Thank you so much for the opportunity.
Thank you very much. Next in support, the Department of Land and Natural Resources, Chair Case.
Good afternoon, Chair, Vice Chair, members of the committee. Suzanne Case, Director for the Department of Land and Natural Resources. We also stand in very strong support. You have our testimony, and I can echo the comments I've heard already, and also add, just on a personal note, that my testament to her holistic approach to health is that I have seen her out on our trails. And so I appreciate that holistic approach, and I know she is already doing a terrific job and will continue to do so in a very important time. Thank you.
Thank you. Next, we have the Department of Transportation.
Good afternoon, Chair, Vice Chair, and committee members. Jake Butay for the Department of Transportation. On behalf of DOT, and especially on my own behalf, we stand on our testimony in strong support. To be a leader, you must have the respect of who you are leading. And Dr. Char has that and more. She knows public health backward and forward. Thank you.
Thank you very much. Next, we have a testimony and support from the Hawaii Primary Care Association, Mr. Hirokawa.
Good afternoon, committee members. Although I'm sitting, I enthusiastically stand on my written testimony in strong support. Thank you.
Thank you very much. Next, we have the Healthcare Association of Hawaii.
Thank you, Vice Chair, members of the committee, for the opportunity to provide our support for Dr. Char's nomination as Director of Health. My name is Hilton Rathel. I'm the President and CEO of the Healthcare Association of Hawaii. We've been working closely with Dr. Char and her team at DOH since she assumed her role at the Department of Health. Our member hospitals are playing a vital role in the COVID-19 vaccination efforts across the state, and Dr. Char has demonstrated continued willingness to solicit and encourage broad stakeholder participation in a variety of key areas. All states across the country are struggling with how best to deal with this pandemic. There are no easy answers, and each day and each week brings new challenges. Dr. Char has repeatedly demonstrated the ability to make sound, evidence-based decisions, to be open to input, be collaborative, and to be committed to protecting the health of the people of Hawaii. She's also demonstrated a very high level of commitment to her responsibilities. For example, last evening, she and I were on the phone at around 8 p.m. talking about vaccination issues. The last email I got from her was at 10:30 last evening, and I was on the phone again with her at 7 o'clock in the morning. That is just typical of her work ethic and her commitment to her responsibilities. So we strongly support her confirmation to the Director of the Department of Health. Thank you for the opportunity to speak in support today.
Thank you, Hilton. Next, we have Kaiser Permanente in support.
Aloha, Chair and Vice Chair. Jonathan Ching on behalf of Kaiser Permanente. We will stand on our written testimony, which was offered on behalf of our hospital administrator and assistant administrator, Sam Balukoff and Andrew Giles. I will just add one thing, personally. I know on behalf of Kaiser, we really respect that Dr. Char, stood up to the task, offering her services to the state of the people of the state of Hawaii during this pandemic. She's been nothing but excellent in helping Kaiser navigate the very complex public health system, and we are very, very much in strong support of her confirmation by the Senate. Thank you.
Thank you very much. Next we have, I'm sorry, we should have had you earlier, Major General Hara.
Good afternoon, Chair, Vice Chair, other committee members. Major General Kenneth Hara, Adjutant General, State of Hawaii, Department of Defense. We stand on our written testimony in strong support. I've been working very closely with Dr. Char for the past 4 months, and she's done a tremendous job at keeping Hawaii safe and saving lives. So strongly support her. Thank you.
Thank you, General. Next, we have Rachel Wong in support.
Members of the committee. Rachel Wong with One Shared Future, formerly a department director and now testifying as individual in our Hawaii community. I stand on my testimony as submitted, that was submitted with great gratitude and appreciation for Dr. Char stepping up and stepping in this way. And I really want to take a moment to highlight that Hawaii is in a great place. And I want to recognize the shift that's occurred in DOH and with the public and our population health. Thank you.
Thank you very much. Next, we have the Department of Human Resources Development, Mr. Wada.
Hi, aloha Chair, aloha Vice Chair, members of the committee, Riker Wada for the Department of Human Resources Development. We will stand on our testimony in very strong support of Dr. Char, and we'll be happy to answer any questions. Thank you for your time.
Thank you very much. Members, that's all the testimony we've received from individuals who indicated they would be present. Is there anyone else on the conference besides the director who we missed and would like to add additional spoken testimony? Okay, seeing none, I'd like to note the written testimony of Kurt Otogoro of the Department of Accounting and General Services, Craig Hirai, the Department of Budget and Finance, Mike McCartney, all in support, and also supportive testimony from Mike McCartney from DBED, Anna Stacchio of the DLIR, Lloyd Rogers of the State Fire Council, Max Otani of the Department of Public Safety, Isaac Choi of the Department of Taxation, Christopher Fortuno of the DOT Airport Firefighters, Ann Sakaguchi of the University of Hawaii of Manoa at Manoa Pacific Imprints Program, all in support. Also in support, Hiro Toya of the City and County of Honolulu Department of Emergency Management, Mayor Derek Kawakami, County of Kauai, Kathy Ferreira, Hawaii Fire Department, the American Heart Association, Speedy Bailey of AMR, William Scruggs of Hawaii ACEP, the Hawaii chapter, the American College of Emergency Physicians, Dr. Linda Rosen of HHSC, Mufi Hanneman of the Hawaii Lodging and Tourism Association, HMSA, the Hawaii Tourism Authority, Hawaii Pacific Health, Hinamauka, Kokua Mau, the Metropolitan EMS, Medical Directors Global Alliance, Paradise Medical Services, and the Queen's Health Systems. Those are all the organizations who submitted testimony in support. There are also approximately 68 individual members of the community who submitted supporting testimony. And that's all we have. Director Char, would you like to say a few words?
Thank you, Chair. Chair, Vice Chair Baker, members of the committee, thanks for the opportunity to appear before the committee to discuss my nomination for the Director of the Department of Health. I'm honored to be leading the State of Hawaii Department of Health with our team of 2,500 strong. I'm here today for 3 reasons. I was asked to serve. I believe I'm making a positive difference by shaping our state's COVID-19 and public health response, and I've dedicated my career to improving others' health and trying to save lives. Before joining this administration on September 16, 2020, I was working as an emergency physician and providing medical direction for multiple county fire departments and EMS. I was also volunteering, kind of providing a medical perspective on COVID-related issues for the City and County of Honolulu. I'm board certified in emergency medicine, and I received my training at the University of Hawaii John A. Burns School of Medicine and at UCLA. My entire education has been through the public school system in Hawaii and briefly in California. While I have no formal training in public health, I have developed great respect and appreciation for the value and comprehensive reach of public health through my many years in medicine, seeing patients in a busy level 1 trauma center and also in community settings. I continue to learn more every day from those who truly are experts in the field, many of whom I have the privilege of working with at the Department of Health. These colleagues are dedicated, passionate, educated, and skilled. To say they work hard is a tremendous understatement. As an emergency physician, we're called to make difficult decisions with far-reaching implications and effects despite there being incomplete data. Being in a pandemic also calls for decisions and action, and while there's much we yet do not understand about this virus, good decisions still need to be made. My experience leading the City and County of Honolulu's Emergency Services Department gave me a good introduction to government and provided me with an appreciation for navigating within a set of rules and circumstances that are really different from the public sector. I'm a firm believer that neither government nor the private sector nor nonprofits can function alone. We must partner and collaborate to solve challenges like COVID-19. Similarly, the Department of Health needs support from other agencies, other branches of government, the private sector, nonprofits, and really the entire community for us to truly improve our public health. If I am afforded an opportunity to continue as a Director of Health, I will focus on helping to lead the team of Deputy Directors and the department towards a science-based, rational approach to help Hawaii navigate through the pandemic and mitigate morbidity and mortality in our community. We must also seek opportunities and seize them when they arise to position the department and the state to take lessons learned and create more streamlined and efficient ways of functioning. We need to use processes and programs created for COVID-19 to benefit the community beyond COVID-19, so that when the pandemic is over, we have a more robust and stable department that's better positioned for the challenges of the future. Thank you for this opportunity to provide comments to the committee. It's an honor to be considered for the position of Director of Health.
Thank you, Dr. Char. Members, are there any questions? Senator Moriwaki.
Thank you so much for taking the helm on the pandemic and your statement that you're learning from the pandemic to have a more robust department. Just wondering in terms of the other programs in the department, whether it's behavioral health or the state hospital, what have you learned or what can you take forward in other areas other than DOCTI I think help the department grow?
Thank you, Senator. So, I think a lot of it, there are things that we're having to deal with because of COVID. So I think to stop and look at the lessons learned, where did we stumble? Where do we need to beef things up? Where do we have pukas that we hadn't recognized? And then to try and fill those pukas so that the next time around we're in a better position. Even just things like, I think when we had our conversation, like DOCTI has managed to hire a bunch of new epi specialists and whatnot. If we can bring in good mentors for them to help them foster and grow their careers, then at the end of the pandemic, we have helped the department, we have helped the state. Even if those people go and work in other places, it's still better for all of us as a community, and we get the benefit of their expertise. And I think it's kind of like paying it forward. But I think that if we get those little gains now, that will position us structurally better for the future. Some of the things that we're allowed to do or forced to do, behavioral health as an example, just even with isolation and quarantine, having to set that structure up. The guys in this department did a phenomenal job of stepping up and creating that safety for the community so that if somebody becomes COVID positive or is exposed to someone and needs a safe place to be, it's available. Well, similarly, beyond COVID, we're still going to need to have some sort of safety valve for the community, whether it's for a behavioral health issue or something else. So to be able to hang on to that or pieces of that isolation quarantine model that we can use into the future, I think that will bode well for us as a community. Just things like that, lessons that we're learning along the way, trying to hang on to those and trying to parlay them into better stability for the future when we eventually come out of this pandemic.
Just as a follow on, have you looked, because of COVID, you've really done a good job in outreach and networking with different agencies in the community, which probably was not really part of the Department of Health structure. But how are you maybe looking at restructuring the department so that it can be more nimble because you have a huge 2,200 member department? What lessons have you learned there, or at least thinking about going forward?
Again, I think one of the realizations is, we're the only state, well, I think we're the only state that has a statewide Department of Health, but no county public health. And so usually it's at the county level that things are operationalized. But because we only have that state level, we're sort of missing that operational piece. It makes it a real challenge to enact some of the things that we want to do or to carry them out. And so we need to partner and cooperate with and rely on and collaborate with community partners, and not only the counties, but also, the entire healthcare sector, the private sector, nonprofits, everybody. I think because of COVID, we've been forced to establish some of those relationships and have those conversations. I think that's going to really position us well for future conversations about non-COVID things. And really, it's a testament to the 4 deputies in this department, because they're the ones that are having a lot of those conversations and establishing those relationships and fostering them. We're looking at systems of care. Where can we be more holistic? Where can we create broader systems of care rather than having these little silos that we currently have? I think just looking at things like that, and now that we have conversations with partners, we learn from them. Are there things that we can take that's working for them? Could we use something like that within our department? Just kind of trying to keep my eyes open and learn as fast as I can. But really, it's the deputies that have been doing tremendous amount of the lift, and the division chiefs, the branch chiefs. Those are all the people that are working every day. I'm sort of listening and learning as fast as I can. But I think fostering those relationships now are going to hold us in good stead in the future.
Thank you. Thank you for what you're doing. Thank you, Chair.
Thank you very much. Members, any more questions? Senator San Buenaventura.
Okay, thank you. I want to thank you, Dr. Char, for stepping up at a time of controversy and working with the legislators and the policymakers on this. I know there's going to come a time and that there may be a difference in opinion as far as the policymakers and yourself as to a proper way forward. And I don't want the kind of public controversy that surrounded your predecessor to surround you. So I guess I'm requesting that you, in the event that there is a difference in opinion, for instance, contact or mass COVID testing, that you work with us rather than ignore us, because we don't want the kind of adversarial relationship to occur, because we really do want what's best for all of Hawaii. Yeah. So Dr. Char, I think I talked to you about this privately, and I just want to see, I don't see anything wrong with you. I think you've done well. The people who have spoken on your behalf have spoken highly of you, and I have great hopes that you will continue to do well. But again, I just request that in the event there is a difference in policy decisions, and the big example was the contact tracing problem and the COVID-19 testing, whether or not you can work with us rather than against us.
Thank you, Senator. I think it would behoove all of us and make us stronger and better as a community to have these conversations. And I can almost guarantee that we won't be in lockstep agreement on everything. That's kind of inevitable, right? So I think it's just a matter of making sure that we're communicating. And I'm very grateful to Chair and Vice Chair for thus far being just incredibly welcoming and reaching out, and that we can have some really open, honest conversations. I think we've managed to do that thus far, and I would hope that we continue that going forward.
Vice Chair.
Thank you, Chair. Dr. Char, you really are a breath of fresh air. We're delighted to have the opportunity to work with you. Over the years, I'm wondering if the department could take a serious look at the functioning and the areas that the district health officers are supposed to be participating in and not participating in. I'm wondering if perhaps those positions have lost their usefulness. So as you're looking at ways to really improve the functioning of the department, if you could take a look at those positions, I think either we give them some serious responsibilities and hold them to account, or maybe we eliminate those positions and do something else with the resources that are assigned to those positions. Thank you.
Okay, I will be happy to look into it and talk to the others in the department, and we'll get a review and we'll get back to you on that. Thank you.
Thank you, Chair.
Thank you. Members, any other questions? Okay, I have a question, Director. You've had a lot of, in working since you came on, there have been a lot of conversations with members about specific issues in the community or about the healthcare, the public health response to the pandemic overall. And I'm wondering if you can share for the members and for the members of the public who are watching, how you see things proceeding and what your priorities are over the next, you have a little under 2 years left. This term is for a little under 2 years. And it's hard for me to envision the pandemic not being a central component of your attention span for the remainder of your time, barring some, hopefully real soon change in the situation. But I guess, can you run through for us your priorities for that time, if we should move forward with your confirmation?
Sure, Chair. Thank you for that question. You know, I was asked about leaving a legacy and whatnot, and it kind of made me chuckle because, you know, the way I see it, we have something in medicine we call crisis standards of care. And I think that's kind of the situation we're in right now. It's like walking in, sort of like, as I think we were saying, it was like being a wartime general, right? And I walked into this in the middle of September, so right after that huge spike that we had in August. My priorities are trying to survive without destroying my physical health or my overall well-being. It's really a matter of, you know, we're in a crisis right now. There are certain priorities that we need to meet. I'm trying to keep the department positioned at least a step ahead of what we envision coming next, so that we're prepared for it when it comes. We know it's coming. And I think it means that we're going to have to compromise on some things, what otherwise wouldn't have been acceptable. It's just reasonable that that's what we need to do to get through this event with the least amount of downside, and salvage as much as we can along the way. And by salvage, I mean things like, you know, lessons learned. Let's stop and take a look. I know we've made mistakes along the way. Let's figure out what they were, why they were made, and how we can prevent them going forward. And if it's something that comes out of it that positions us better for the future, all the better. That's really the realm within which I'm functioning right now. It's to address the pandemic and really stop and review and say, what lessons have we learned from this? What are the processes that are in place right now by virtue of COVID that we can take advantage of to help us build and position ourselves for the future? The budget is really, really tough right now, but are there ways we can streamline things so that we actually can be a little bit more nimble, we can function a little bit better? Are there ways that we can provide more holistic care and get rid of some of the silos that currently exist? And are the rules such that now we have a little bit of latitude to be able to play with some of that? That's kind of where I am right now, and that's what I see my focus as being for the next 91 weeks. And really, you know, the deputies are the ones that are running the department. They're running their administrations, and they're doing an amazing job, because it's not like they don't have to also work on all the COVID things as well. So I think that's where it's really helped to have a good team, because I think amongst all of us, we're all pitching in, we're all trying to work together. When things come up, we're trying to divvy it up and make sure that things are covered. And so I think, you know, even that, I think that's really important, just that we're building teams, and we're building, you know, we're letting people in the department know that they really do have the expertise, and what they do really does matter, and just trying to back them up. You know, when public health goes well, it's invisible. And I think that's really one of the things that I've noted is, you know, when everything's going fine, you don't even think about having fresh water to drink, and not worrying about food in a restaurant, and not worrying about, you know, whether your environment or your air is clean. And it's when things don't go well, like there's a pandemic or there's a catastrophe, then we start thinking about it. But all these things are in place, and there's all these people who are dedicating their lives to working on this day after day. And so I think, to the extent that I can support them, that we can support the department, that we can take lessons learned, that we can use some of the processes that we're having to deal with now to build a more robust framework for us going forward. Those are all good things to do. And that's what I'm trying to get out of this pandemic, and just trying to keep us at least one step ahead so that we're well positioned to deal with whatever's coming at us next. So many changes and so much that we don't know, and we're just learning along the way about this pandemic. Sorry, kind of long-winded answer.
Good answer. Members, are there any other questions? Okay, seeing none, members, you know, unless there are any matters you'd like to discuss in a recess, I think we should move to decision making. Okay, great. So Director Char, it's been a privilege to work with you since you came in. I think that you are Well, in my position as the chair of health, I find you well qualified, and I think your record since taking the position has been exemplary. And so I'm happy to recommend that the committee advise and consent to your nomination. Members, is there any discussion? Okay, great. So Vice Chair, I recommend we advise and consent to the nomination of Dr. Char as Director of the Department of Health.
And chair votes aye.
Yes.
Vice chair votes aye. Senator Moriwaki.
I vote aye.
Senator San Buenaventura.
Aye.
Senator Favela. Senator Favela, excused. Chair, your recommendation is adopted. 4 ayes, 1 excused.
Thank you very much. Director, congratulations. This hearing is adjourned. Aloha.
Aloha.